My stomach is still not flat after liposuction. That is one of the common complaints patients have after undergoing the procedure. And what are the reasons for that? Why isn't the abdominal wall as flat as it can possibly be? Number one, you have diastasis from childbirth. During pregnancy, the abdominal wall expands, the muscles loosen up, they stretch, and afterwards they never bounce back to the same state. So you have diastasis, and liposuction cannot fix stretched muscles. So for that, you need a tummy tuck. Diastasis can also happen if you've never had children, but you had weight loss. And so if your BMI was extra high, your abdomen was distended with visceral fat, and after weight loss, the muscles are stretched out just like you were pregnant, and the muscles don't bounce back. So in that case, you also need to repair the muscles with a tummy tuck. If your BMI is high, let's say over 30, then the chances are you have visceral fat. Having fat around the intestines pushes the abdominal wall out, and you cannot liposuction the fat around the intestines. You can only liposuction the fat that's underneath the skin, between the skin and the muscle. So, therefore, you will not be all the way flat after liposuction. There's a limit of how much fat can be safely removed during a liposuction procedure. So if your BMI was high and you were over that 5-liter limit, then some fat needs to be left behind for safety reasons, and so you might have fat left behind for those reasons, and you might need a second round of liposuction. I usually approach the high BMI differently. I split the procedure into two parts. Let's say if somebody's getting the Lipo 360, first you do the complete liposuction of the abdomen, and then complete liposuction of the sides and back as a separate procedure. That way you can take 10 liters of fat and you're not doing half a job. There might be some scarring, which is a normal consequence of surgery. Sometimes it's called fibrosis, but it's basically just scarring underneath the skin, and that can cause some volume to be present and for you not to be as flat as you could have been. And the more liposuction procedures you have or have had in the past, the more chances are you will have this scarring and the less flat you will be. If you're just getting liposuction, you cannot expect to be 100% flat, and that's just because of those reasons. And so you have to kind of accept that you will be about halfway, a little bit more, but you will have some still distension present. And so there's a few things you could do to help with that. Number one, losing a little bit of weight will shrink the visceral fat, will get you flatter. And number two, hitting the gym, doing some crunches will tighten up the muscles, also will make you flatter. And number three, you might just need a tummy tuck.